So the next on our agenda is approval of the minutes. Have you had an opportunity to review the minutes? All right. It's been moved by Ralph, second by Blake, for the minutes to be approved. All those in favor signify by saying aye.
Aye.
And opposed by nay. Motion passes. Agenda, we don't have a heavy agenda today, but we do have some information being provided to us by Ashley. So you want to get started with the people and culture in action?
Good afternoon, everyone. So I am super excited to be before you for the first time in the calendar year 2025 and share with you all on some pertinent updates and what we've been up to in the HR space. So I'd like to start by highlighting the program that we just had here a few weeks ago, where we brought our youth together to really focus on our children with our business. What you're about to see next is a short video that just really highlights a wonderful day that we spent on really reimagining and really getting excited around patient experience. As you know, Dr. Duncan has proclaimed 2025 as the year of the patient. And we know that every year is the year of the patient, but we are doubling down from a leadership perspective to ensure that our leaders are equipped to lead teams in a way that really does create best experiences. And this day is really to kick off today. Some of the key activities including, we had a fantastic keynote by Jeff Doucette, Press AD CNO. He really talked to leaders about really the correlation between employee experience and patient experience. And he was phenomenal. There was so much energy around him. Dr. Duncan got loud and shared so much stuff with us about the journey. It was wonderful. I haven't said this to her, but I want to say this publicly. There was a vulnerability. You, Dr. Duncan, when you talked about patients, that was just touching. And I think the feeling was palpable in the room. It really did set the tone for people to soften up and really lean into why many of us do this work. And I really think it added this intangible energy to the day. So I just want to say that to you. Thank you for that, because I do think it set the tone for it.
Thank you. Actually, I'm not sure if I was called vulnerable. I'm just kidding.
Really focus on the patient, which I thought was wonderful. And then I would also say that many people were really, really pleasantly surprised about the breakout sessions we had in the afternoon, where people actually got to workshop through real solutions that we could implement to continue to improve the patient experience. So it was a wonderful day, and we're really proud of what we delivered to our people. Right. So we just want to highlight, it's a sneak peek that the Rose Award time is here again. As you all recall, this is our annual award where we recognize those teams that have exceptional patient experience and employee experience. We did do a soft announcement of those leaders at the LDI that we had last week. We are not sharing their names with you today because we realize that we're not announcing any units until March 11th, and we don't want people to hit the HR committee report or to watch and have the surprise spoiled. So we will bring back to the next HR committee the actual winners and give you some highlights of those teams and the remarkable things they're doing, both in patient and employee experience. So now we'll pivot on to our strategic updates. Want to really start by getting loud. For the first time
that I'm aware of in HR, we have published a year in review, and I'll share that with you all here in the next, I'd say, couple of weeks. But we wanted to just highlight some of the things that the HR and patient experience team were the most proud of in 2024. We saw a 13.9% reduction in year-over-year first-year turnover. We know that first-year turnover is a true marker of engagement. When we hire people and they leave in the first year, it really does say that something is broken or something has an opportunity to be fixed in our system, and we're really proud of the reduction we've seen. I think it really does speak to programs like the CEO Breakfast and many of the other onboarding and engagement for that first-year experience programs that we have here at JPS. Our volunteers served over 51,000 hours through the Helping Hands Project. We increased our nurse residency cohort by 9%, which we know is vital to our nurse retention and nursing pipeline. And we see with those nurse residents, well over an 85% retention rate over the first year. We placed 100% of our administrative fellows last year, and so they are all in positions as, I would say, what I call baby leaders, but they are in baby leader positions and thriving in their respective areas. We implemented market adjustments to ensure that we remain competitive across clinical and non-clinical areas, bringing our pay here at JPS up with the market in Dallas-Fort Worth. We were awarded with Headspace Award, which is really an award that really does honor those workplaces that really focus on behavioral health and mental wellness and fitness as a best-in-class approach, as well as the Cigna Healthy Workforce Gold designation, which again talks about our outstanding wellness program. As you all know, we were always ready this year. We had 0 findings on the HR chapter and the patient grievance chapter of the Joint Commission, and we are really proud of that because it speaks to quality and that we are focused, even in HR, on making sure that we are providing exceptional care for our patients. We won the Gallup Exceptional Workplace Award, and I am excited about what's to come for the year ahead. Although we can't share, we really feel like we are strong contenders for 2025. And so we hope to repeat that honor. We had a 10% increase in employee recognition programs, and I'm going to share a little bit more in a minute about our incentive services program, but we know that there's a direct correlation between how employees feel recognized at work and how engaged they are and how they provide quality care. So we're excited about that. We had exceptional engagement on our engagement survey in terms of participation. We did a lot around process improvement last year. And one of the things that is what I call a quiet win is that we relaunched a people analytics dashboard. So now all of our leaders have access to data about turnover, net hires, demography, and volunteer services. And it is the single source of truth for the organization, which is something we've not had. So we're proud about that. Over 48,000 EAP visits last year with a 93% satisfaction rating. So our employees really do tough jobs, but we have support for them right here in the building to help ensure that they are, again, mentally fit and resilient to provide the best patient care. And then last but certainly not least, spiritual care facilitated over 37,000 chaplain encounters with both our patients and our employees, and reintroduce what we call a interfaith and reflection space that both employees, patients, and their families can use. So these are the things we're getting loud about in 2024. Any questions up until this point?
I had a couple of questions on you increased nurse residency cohorts by 9%.
Sure.
What did we do the year before? I mean, we increased it 9% from.
So I can tell you, I will bring that back to you. I have that
Okay.
data. I
All
can
right.
tell you how many we
Yeah.
placed.
Yeah, we've got Phyllis, or, number one, I'm actually trying to get the actual number, so.
So we,
It's been year-over-year increase.
So-
Because we've expanded the number that we allow in the cohort. So year-over-year, that's been a very creative and exceptional work for pipeline for those new nurses.
Yeah.
They did increase the cohort, so they started out with 2 a year, 3 a year, and now they do it 5 times a year. We allow.
Okay. It would just be nice to see that increase because it's a great program. I'm not taking anything from it. But when you do it as a one-time, it doesn't show this work that you've been doing all over
sure.
for a period in time. So that's kind of some of the things that I know you've been working on, the employee recognition. So you've done some things and you improved about 10%. Did we only have 10% of our employees involved in it? Where are we now? That's to kind of add to your next report.
Yeah, absolutely. I'll bring back for you. We actually can track it year over year, the number of residents we had. And so I will bring that to you year over the year, as well as we'll share with you some retention metrics, which I think
Good.
are probably the best kind of outcome is
Good.
that when we build them from baby nurses, they stay with us.
Right. I want to say HR is so critical to an organization. So your department do a lot. And in different areas, you have the retention and rewards. And so if you would think about maybe, I don't think we meet 4 times a year, maybe they could come and make us aware of a little bit more about what they do. And so we will know, because they are a vital part to our
Sure.
system.
So you'd
Okay.
like to see some of my directors and things come? I would be more than happy to bring them. That's wonderful. They'll be excited about that. So I'll take that as a takeaway. Any other questions before I move forward? So I just want to, I feel like every time I meet, because we only meet quarterly, I should share just kind of a refresher on the strategy map. As you know, that we are 100% anchored to the organizational strategy. We are focused on improving access, financial sustainability, and being the best place to work, learn, and practice medicine. And the ways that we're really prioritizing that work this year are really focused on HR ops and processes, workforce optimization, and talent mobility, which simply means that we want to be the best stewards of the workforce that we have the right people with the right skill sets in the right roles. Total rewards, of course, is going to always be important. People want to know how they're going to be paid and what kind of benefits they have. Employee engagement, again, is an area of focus, because without it, we can't provide exceptional patient care. We always are going to focus on recruiting and retaining the best and brightest to come to JPS. And I think one thing we should call out is that we did kick off our M4 Cloud Suite, Human Capital Management. So that's our new cloud-based technology for HR. We started those meetings 2 weeks ago, and we are so excited about that 12 to 24-month project. We're on the end of it. We will have a brand new system that will allow us to do many of the things that we can't do now, but we're excited about that. And so as a part of that work, we are not just working on our technology, we're working on our processes, so that when we get this new fancy system, we will have the HR workforce, the skill sets, as well as the processes to match it. And so we're really excited about that work and what will happen over the next year or so. And we'll continue to share more about kind of what that progression looks like. Any questions? Yes.
Yes, question.
Sure.
Speak up. Have we started the process for fiscal year, I guess, 25, 26 for our benefit RFP? Is that already started?
So we have not started that yet, but we actually had an internal planning meeting this week. And so that's where we just start the process of laying out, what we need to do for the year, what the cadence will be. And so no, that has not started yet. But as you recall, we went to market on all of our major benefits last year. So we are in the first year of those contracts. Many of them were incumbent, so many of them were reawarded. But we are, this will be an opportunity for us to start to evaluate, how those are progressing and so on and so forth. So we have not started that process yet.
Do we annually survey employees on benefits and see where happy or what their things they
So it is a component of our engagement survey. We do not do a separate survey, but we do listen through our engagement survey, and trust me, we get plenty of feedback around it. The other thing that we do is that we, at the end of we have several different benefit and wellness kinds of programs and initiatives. We often will include a survey at the end of that gives people an opportunity to real-time share any questions they have, their voice, or even talk about things that they're interested in. And a great example of that is Dr. Duncan and Renee Kennedy, who is my director of Total Rewards, had heard a lot of off-cycle interest in pet insurance. And last year we introduced that because we heard off-cycle that people were really interested in pet insurance. And so we continue to listen. So we have several listening mechanisms, and we do include that in our engagement survey.
How's your participation in pet insurance?
So our participation in pet insurance, it's a brand new program. And I actually just looked at it the other day. I think it's somewhere in the less than 10%. But again, it's 100% elective. It is, it didn't cost us anything to offer it. And for those who use it, they've given us really good feedback about the coverage that we have.
Good.
Yep.
You do some sort of surveying benefits every year.
It's a part of our listening through our engagement survey. Yes.
New system. So see, those are lights in the system up there?
You
Those-
asked us to replace the camera.
Mhm.
So we now have upgraded this room for you.
Wow.
Everything can be.
The room is a hot mic, Blake. So for those who were in, for those who were,
Fun.
for those who were in finance this morning, I brought a contract around incentive services, and that brought an opportunity for us to share a little bit more about our incentive services strategy. And so we wanted to bring that insight to the HR committee. And so that's really what I'm going to share about today, is a little bit around our incentive service project and kind of how we're utilizing it. So first and foremost, incentive services is a company that does many types of incentive services, but they specialize in incentive services for healthcare. And so this is just kind of a splattering of the hospitals or health systems that also use this system. We think that's really important because ultimately what we know is that healthcare is a different industry, and what our people need might be slightly different. And incentive services, who is the provider that helps us to do our rewards and recognition program, really does do more of a concierge type of approach for us, and really does help us to be able to answer the rewards and recognition call. So we often get the question about why recognition is so crucial to our people strategy. And what we know is that generally speaking, 59% of managers feel like they do a great job in recognizing their team. But conversely, 35% of individual contributors feel like their manager does a good job of recognizing them. So generally speaking, in the workplace, there is a disconnect or a delta between how well leaders think they're recognizing and how people feel recognized. What we also know about recognition is that it is getting more idiosyncratic. The way I feel value and recognition, and the way you, Dr. Emerson, Reverend Emerson, feel value and recognition is different. And this platform really does allow us to create nuanced recognition that is meaningful to people. And it has worked. If you look to the right of this slide, we have charted question number 4 on the Gallup survey, which is in the last 7 days, I have received recognition or praise for doing a good job. And it has substantively improved from 2021 till today. 2021, we were at 3.63%. And over the last 3 years, we have really doubled down on teaching leaders how to recognize, but also building a culture where employees recognize each other. And it has paid off, and it has really helped us to increase our scores in that space, but also for people not only to want to be recognized, but to understand that the culture of recognition is reciprocal and give and take.
So can you explain what we're doing to increase recognition? Is it training for the managers?
It's a little of everything, and that's actually in this deck. It is talking about the fact that we all own engagement, and that if you want to be recognized, part of our responsibility as good citizens is to recognize others. So what you'll see as we get further in this deck is that the majority of our recognitions are not tied to any monetary value. They are just people congratulating each other or thanking each other or showing gratitude. And what we know about recognition is that it's infectious. And so we are training leaders on the importance of it. We do talk about it in new leader orientation and new team member orientation in the CEO breakfast, having a posture of gratitude and a posture of appreciation. So we've infused it in kind of implemented it in every area of our education, but it is not just the leader's job to recognize and reward. It is a continuous 360 feet loop of, people thanking each other for just everyday deeds of kindness or helping them out.
Do you think recognition and appreciation are interchangeable terms?
I would say yes and no. And I would say that I believe that people want to be recognized different ways. But I would also say that recognition is affirmation of appreciation. I don't recognize you for something that I don't appreciate. So I view appreciation as the act in terms of how I like the way I feel. It's the thing that prompts me to recognize you, and recognition is what I actually do. Does that make sense?
Is recognition more of a public thing?
So it doesn't have to be. And what we find about recognition is that many people never want to be publicly recognized. A lot of people just want a handwritten note or a sticky note, or for somebody to stop by their office and say thank you. There are some people who don't care if you ever write them a note. They want to be, get an increase or get a spot bonus or get points. There are people who, want to be called out in a team huddle, and people who never want that. And so that's the beauty of this platform, is that it allows for differentiation in the way we recognize folks.
Yeah, I would say that appreciation is the second paycheck that you get at work. And I like it that Gallup's requirement is each week. It's not once a month, twice a year, every week. In the last 7 days that you've been recognized or appreciated.
Yeah. I think it's important. I mean, saying thank you goes a long way.
Yeah, I think you find that when you get a pat on the back from your coworker.
Mm-hmm.
Means more.
Mhm. Building community.
Right.
In any organization.
And sometimes, especially for nurses, it can be from the patients that they receive things.
Absolutely.
So it really is just kind of who you interact with,
Right.
and how it is that people receive that interaction and then respond to it, as Ashley said. So
Absolutely.
we talk about, it's not always your leader, but it can be your coworker.
Mhm.
I enjoy when I'm rounding, when patients, say, hey, this is a great place. Thank you for the work that you did, and be able to reciprocate that and say, well, we truly appreciate that you're using JPS. So really getting staff to understand that recognition can come from multitudes, even from board members. And first of all, I want to recognize and thank all of you. Appreciate you. So you can please say, I've done that in the last 7 days.
We're built on the culture.
See, it's infectious. Right? I was just sitting there, and I'm going to thank Blake for being an amazing board member.
And I think even it stretches to, me talking to a member of my church about how great JPS is, that's infectious, because then it'll move into,
Mhm.
because you don't know who you're talking to in the public.
Right.
And you
Mhm.
manage us up, and we talked about that as part of our leadership sessions.
Mhm.
Really manage when the nurse says to a patient, oh, you have Dr. So-and-so, he's amazing.
Mhm.
That is so meaningful to a patient.
It
Is
is.
it not,
Yeah.
Dorothy?
Yes, it is.
Yes.
So,
It is.
Mhm.
Because I'll say this quickly, many of the events that take place around in the community, for example, the hostel function
Green.
this past Saturday. I always make a point to go to the JPS table. I try to get souvenirs, but I make a point to go compliment. I go make a point to pat on the back.
thank you.
So
Appreciate
that goes a long way.
It does.
It does. And I will tell you, the other thing that we don't always think about is it reinforces positive behaviors. When you go into some of these units and you see the wows all the way across the wall, it is reinforcing quality behaviors, infection prevention behaviors. And when somebody gets their little name on a sticker, and it goes on the wall, it really does say, oh goodness, they got recognized for that. It does really create this stickiness around positive behaviors that we want to reinforce. And the simplest thing really does go a long way.
We were built on the culture of gold stars.
Yes. I love my stars.
So much that I make sure I buy my own. Okay.
So we're highlighting here just a few of the network-wide campaigns that we leverage our rewards and recognition platform for. Of course, National Employee Appreciation Day, Hospital Week, our engagement survey, and some of our other kind of big contests and events throughout the year. We also have created a scenario now where departments can buy points for their department initiatives. Our departments do have some recognition dollars that they can use, and so they can stand up their own, individual department-centric campaigns, and we help them with that, so that they can then also use the rewards and recognition platform for department-specific initiatives. So a little bit more about nominations and milestones. So in addition to being the rewards and recognition platform, this platform is agile enough that we actually use it as a nomination system for all of our most prestigious awards. So think Daisy, Sunflower, Excellence Awards. We're able to collect those nominations through there. We also use it to administrate programs through our wellness program. So we have a Great Beginnings program that really does incentivize expecting moms and families to get timely prenatal care and to choose JPS as the place where they want to have a baby. And so if they make that choice and they meet those milestones for care, we reward them in our rewards and recognition platform. And so we've received really good feedback about that.
I just had a question of that comment on the other recognition.
Sure.
I love, like, my sister's doctor, she's here quite frequently. And so one of the things we were talking to one of the transportation team, they're like, can you please tell them to not get us some, all like, in some of the recognition, some of the celebration.
Really?
Just in terms of transportation. Like when I say transportation, being moving all the patients around, walk. I work there, and so they're just.
We always tell the support system, they really love it.
Yeah,
They're on
they
patient.
are the glue.
They can really do service recovery for us, so really using that.
And they're really, really fun. They're talkative and they're joyous and great. And that can make it like somebody who has to go to get there. Sure. That's a team critical.
Like a special
Yeah.
call.
Yeah.
I've got the note down and we'll see if we can give them some extra love this month.
Yeah. Okay. All right.
So one of the things I think is important to share just contextually is utilization. We've really driven adoption of this program. And I think what I really want you to get from this slide is that when you look at the points that actually we deployed for, and I'll share this in a graph, for those point-based. And so the wows are those recognitions that don't carry any points. So anybody can give a wow. The high five, the round of applause, and the VIP points must be given by leaders, and they can be given by a leader and they have a point value. What we see, is that 3 times more wows are given out than those with points. So when you've really created a culture of recognition, it doesn't matter whether a point is attached. It means that we have a flywheel here of recognizing each other for good work. And I think that's what I'm most proud of. We are able to have good financial stewardship with this platform because we don't actually pay for these points until they're redeemed. And so people have the points, they can, choose to, we have some people we call point hoarders who, really save their points up for something really special and they hold on to theirs. And we have others that redeem them just about the same time they get them. But, right now our utilization over 3 years sits at about 53%. And so we're not giving out tchotchkes that people throw in a closet. We're giving people the opportunity to choose something meaningful for themselves and redeem when they want it. And we don't have to, pay for it until they make the determination that they're ready to redeem, which we believe is good financial stewardship.
So what can you redeem your points for?
All kinds of things. So there's a marketplace where you can go and each point has roughly the value of $1. And so you can redeem from anything from a gift card to a cruise. And we have someone who saved up for several years and bought a Carnival Cruise gift card. And so she will say that JPS sent her on a cruise, but it took her, probably she started in 2012 when we started this program and it saved up to last year. And so there are a myriad of things that you can choose from on the platform to be able to shop for.
Is that what incentive services? You mentioned earlier in the slide that their organization, I guess, is something called incentive services.
It is incentive services.
That handles the point redemption?
It is. They handle the entire interface. So the portal, and they also send out e-cards and birthday cards to our employees to their homes. They handle several different services for
Tell
us.
me about wows. How do you give them? Do they have points attached to them?
So wows do not have any points attached to them. And you go to the rewards and recognition platform, which is available on our intranet. You put in the name or the names of the people you want to recognize. It gives you an opportunity to have a short message and tell what you want to recognize them for. It also includes, you can, add a little photo or gift. So you have something funny to it. And then you send that wow out electronically. It hits the person who is the recipient's email. It also notifies their leader that they've been recognized, which then gives an opportunity for the leader to get loud about that recognition. So
And
that's
it's
how it
all
works.
Integrated by city services handle all
That is correct.
the
That's-
technology.
They do. They handle it all. Yep.
And you see the flyers around the hospital.
Mm-hmm. Yep,
Very recognizable.
they are.
very accessible. I always like seeing them out there. You can see some people snapping the QR code.
Yep, yep.
Yeah.
Absolutely.
And we used to do this at the law, every law firm that I ever worked with had that system, a reward system instead of, you know, doing a turkey or doing other gifts and all like, I think what I got a TV or something.
Yeah. you can-
I mean, it's a great way that, and that's a great way for people to be able to get what they need.
Yeah, absolutely.
I love these numbers. Love it.
They walk inside.
Mhm.
You stay out, but they just stay with the experience. And outside. It could be respectful.
Sure.
Or it could be stated in other. Just email it.
So the good thing about our relationship, since we've been with them since 2012, we work with IT to get everything whitelisted and it's all branded with JPS. And so that's the one. Yep. So we've worked with IT to make sure that it's closely branded and people recognize it. Yep. Any additional questions? I would like to just highlight here that I think this visual demonstrative really does speak of a culture of recognition. As you can see, WOWs way outpace all the other points of recognition that would have points attached to them. So people really are not as focused on the points as they are the feeling of appreciation and recognition, which I think is really important. We continue to add strategy around this. We actually just worked with incentive services to get a new report that we call the unrecognized report. So now we have the ability to see into those areas and those individual contributors or individuals who may not be recognized as frequently. We know best practice says that between 8 to 12 acts of recognition in a month really does keep an employee encouraged and engaged. Our average here at JPS is 9 recognitions per month. So we are right there at best practice. I'm clicking too fast, but we now have the ability to drill down into those areas where recognition is an opportunity and work with those leaders, cross-reference that information with employee engagement, so on and so forth, to work with those leaders to improve their behaviors of recognition.
Can you briefly describe the high five around the applause?
Sure. The high five is essentially a recognition for doing something good. It carries a 5-point value. Leaders have the ability to give those. Round of applause carries the value of 10 points, and leaders have the ability to give those. And VIPs are when you do something phenomenal, and those carry a 30-point value, and leaders have the ability to do that as well.
On these numbers, are they unique numbers or are these for multiple times?
So they are not unique. So we do not have the ability. We actually do have that report, how many people got, how many unique impressions, and we can share that, but this is just more aggregate.
That would be nice to make sure that
Okay.
your numbers, I might be one of those that run around and get wiles from everybody.
Well, so I will tell you, we also have monitoring, and that's one of the reports that we have. So if there are variances, we sad to say, we had some scratch offs one year, and we had someone who got their hands on a stack of scratch offs and just redeemed them all for themselves. And we were able to, they caught that variance the same day. We pulled those points out of the bank and we did cancel that employee. That's a very rare anomaly. Those kinds of things don't happen, but we do. In the next year, we'll be placing more of a strategy around making sure that there is appropriate, that we are spreading the wealth in a way that's equitable. But not only that, that leaders are connecting the dots between recognition and the outcomes they're driving.
What's the scratch off?
So during the survey, for those people who take the survey, early adopters, we round and we give these little scratch off tickets, and you scratch it off and you get a point value in there. So it's either a wow, a high five, or a round of a VIP. I'm not a wow, a VIP, a round of applause, or a high five. And so employees love them because you scratch it off just like a lottery ticket and it shows the point on there, the point value. And then you go on to rewards and recognition and you type the code in and it adds those points to your bank. Well, we have a small number of them. We give them out sparingly and each, somebody may get one per year. Well, we also give a certain amount to leaders to give out in their units during that time. And somebody got a stack and kind of tried to load their account there.
Counseling, you get somebody does something like that.
It's a code of ethics issue. It's an integrity issue. Yeah.
I thought you were going to say when scratch off that I have a chance to go a lot.
No, we are not selling lottery tickets on the JPS. We are selling engagement, but we are not selling lottery tickets.
But one thing, as I look at this together is that we now come to board meeting, Dr. Duncan is on the screen that they live. To me, that connects with why. For JPS.
Yeah. And on that note,
Any other questions on the recognition?
any other questions on recognition? So, so last year in February, I brought to you our workforce by the numbers. And so my goal is to refresh that annually and share with you what our workforce looks like each year. So this is a quick snapshot and I won't go through all the nuances, but we've got about 7,500 employees across the network. 96% of those employees serve in a full-time capacity. 79% enrolled in one of our benefit plans. We've still got 5 generations in the workforce, which is a really cool experience and also a great opportunity to make sure that we're meeting the needs of all of our workforce, with the most pervasive generation in our workforce being millennials. We still have, 3.2% of our employees identify as veterans, and the average tenure is nearly 7 years, which I think is really speaks to the work that we do here in engaging and retaining our staff. And then we, absolutely have a workforce that represents the patients that we serve, which we're proud of. And we are typical in healthcare in that 7.8 out of every employee is a woman and 2.2% is a man. So we are a typical healthcare organization. Any questions about our workforce by the numbers so far?
What is our open position?
Vacant.
Our vacancy rate? I can tell you, I don't have it off the top of my head, but I get a report every week, so I can follow back up with that. And if you'd like, I can do some more metrics around talent acquisition for the next board. I'm more than happy to do that. So one of the metrics that we continue to watch is a physical year-over-year turnover trends. As we shared, we did a great job last year with reducing overall turnover as well as voluntary turnover under 1 year and overall turnover under 1 year. Where we're really going to get surgical this year and focus is around our nursing turnover. And we're in particular, Phyllis and I will partner to try really hard to look at how we reduce voluntary turnover under 1 year in our nursing space. As you can see, we did reduce that number last year, but it was not a full percentage point. And so if it's not a full percentage point, I'm not happy with it. And so we will continue to lean into that. We do a lot of work to support our workforce. We are a Pathway to Excellence organization. We, do targeted rounding for new nurses. We think the nurse residency program is a phenomenal way to create stickiness. And we have done a lot around our recruitment efforts to create opportunities for people to have realistic job previews and to round on the unit, even as prospective nurses or prospective nurse residents. And we believe that much of that is moving in the right direction, but we still have quite a bit more work to do. And so we will focus on that this year. Any questions about this slide? All right. Just want to share with you high level what our tier two, or not tier two goals, our secondary goals are for the year. As a team, we really are going to continue to work on, getting more surgical with our engagement. As you all know, we sit at the 97th percentile. So the reality is where we go from here is maintaining, but also getting more surgical about those areas with the most need, who need the most support. And this year, those are our bottom quartile teams. And so we're really wrapping our arms around them to help them to get from lowest performing in the system to higher performing. And so that's our goal there. We also are going to continue to look at candidate experience as a measurement using Net Promoter Score, our time to fill, how quickly our response times are, and whether or not our candidate experience is one that is pleasant from the time a candidate reaches out or we reach out to them for opportunity for a job to the time they start. We really want to understand how they're experiencing JPS. We're also going to continue with our student pathway strategy. And so our goal this year is to engage well over 1,000 students. I will tell you, in partnership with Academic Affairs, we have launched the Shine High School Internship Program, and it has had a phenomenal level of interest. Just throughout the application process, we had well over 600 applicants. And so, and even on the interest meetings, we had 200 and 300 families and students show up to say they want to come and learn more about healthcare. We're excited about that. We continue to partner with volunteer services, academic affairs, and the local school districts to create interest and opportunities for students to be able to experience healthcare at JPS. Again, we are going to continue to focus on voluntary turnover under 1 year, and then we will also continue to focus on creating rigor around our labor management process so that we are ensuring that we are good stewards of labor and that we are looking at every FTE to make sure that we've got the right talent, the right time, and the right role. Any questions about secondary goals for HR this year?
Actually, let me go back a slide.
Sure.
First of all, what software do we use that generates all this?
Power BI is the,
This Power BI?
it is Power BI. Mhm.
There are numbers in the dark blue horizontal bars at the top
Sure.
that don't have a percentage by them. I assume those are absolute.
So the percentages actually speak to the overall percentage. The number that you see in the dark blue is actually the involuntary termination count. The percentage you see above that, and really it's a matter of how small we made it. We had to condense it down. The percentage that's actually the overall percentage. So if you look at the first box in the top left, the employee turnover trend, for fiscal year 22, the overall turnover rate was 23.98%. In 2023, it went to 19.18%. 2024 down to 16.72%. So that percentage is actually a correlation of total turnover.
Okay, so those
for
are
that.
absolute numbers and the percentages.
Yes.
And this question, nursing turnover, what is industry standard?
So if you look down here, down at the bottom, our Saratoga benchmarks are down here in the bottom in that blue table. So first year of service turnover rate for nurses, here we go. So the median is 25%. So we're just above median. I'd like to get to median over the next 2 years. It would be great to get below that, but median means we're at average. See that down at the bottom? For first year of service.
The very bottom.
Yep, down at the bottom. If you look under the graphs, those are the Saratoga benchmarks, which is what we use as a national benchmarking tool. See?
And we were at 30.22.
That's correct. So we are above median, and my goal over the next 2 years to get us at median or below.
Okay, and then for the whole nurse population, not just the rookies, what row would I look at there?
So this is everyone in their first year of service. So it's not just first year nurses, it's nurses who come to JPS and how they perform in their first year of service with us. But then if you look at all nursing turnover, that's the second row.
Okay.
And
14%.
That is correct.
And we're just over that at 15.03.
Yes.
Yes, 15.03. So we're just above median.
What is your goal?
My goal over the next 2 years for first year turnover is get to median. And then my goal, I would say probably over the next 2 years, is to get below median for overall nurse turnover. I mean, to be in the 25th percentile is exceptional, particularly for the population that we serve, because we know that we support patients with a myriad of complexities. But I always want to be better than average. I'm not, so I always want to beat average. But
25th percentile achievable?
I do believe it is achievable.
Well, that's where your engagement, the recognition can be.
It does. Does. So this particular, my data only includes full-time company 100 because it's the cleanest way to report. It does not include PRN or agency or seasonal nurses. The Saratoga benchmarks, I believe, only includes full-time, but I need to confirm that. Yep. Any additional questions before I move forward? Any questions on goals as I move forward?
No.
All right. The last thing I have for you all today is I'm presenting a policy for consideration. That's the social media policy. Believe you all have it in the packet. As you all can imagine, with all this going on, the purpose is to ensure that the use of social media by employees is aligned with our organizational values, that it supports our commitment to patient privacy, and ultimately that it fosters a positive and a professional work environment. The scope of the application of this policy is that it applies to all employees and team members engaged in online communications and social media activities, both during work hours and outside of work. And really the core guidelines outlines for us the appropriate usage of social media in the workplace, whether people are on shift or off shift. It establishes expectations about people's commitment to ensuring that they're posting things that are factual, professional, and ethical. But most importantly, it does establish expectations around us safeguarding PHI, proprietary, and other confidential information. And so, ultimately, we want to make sure that we are mitigating risk as it relates to, sharing things that shouldn't be shared with the public, and we are protecting our patients who are receiving care here, that we are positioning our employees to really be a good representation of the JPS brand, and that we are providing guidance to employees about our expectations around how they operate with social media.
Comment or question or both.
Sure.
Just skimming this is not intended to limit anyone's First Amendment rights.
That is
Politics, no matter how much we may be offended, right? It's
absolutely.
strictly limiting patient confidentiality, things related to JPS.
It is very focused on making sure that people are not taking a selfie in a patient care area and divulging PHI or identifying a patient inadvertently. It is designed to make sure that people are not posting confidential information that wouldn't be otherwise available to the public. It is also aimed at setting the expectation that leaders who engage or employees that engage with our social media platforms do so in a way that is responsible, so that they're not posting, erroneous information and tagging us or being ugly and tagging us. So we're not in any way trying to limit people or cool people's ability to speak freely, but we are setting parameters and guardrails around how we expect people to engage related to JPS things. And also we're asking people, you shouldn't be posting during your work shifts. You should be focused on patients. And so setting some of those expectations about, baseline behaviors around social media etiquette.
Whether you're representing JPS or you're
Correct.
representing yourself.
That is
two
correct.
different kind of
Two different
types.
things, correct.
You would not want someone to represent JPS and say, I'm for the, for school
Whatever.
vouchers. or
Yeah.
something. It's not appropriate, but you
Yeah.
may, as a parent.
Yeah, speak
you know,
independently.
As long as you're not have your JPS badge and you're not posting as a JPS, you may
Yeah.
some social media regarding that. So just understanding who you're representing and what the environment is.
So
So this is like open to JPS.
So it could be, but it's also posting your own personal page. So this is a great example. I actually did a training several years ago about cautionary tales. And 2 or 3 of those cautionary tales were, one of them was that someone posted a shot in an area where there was a patient. They were taking a selfie. There was a patient in the background. And actually, I will share that presentation. And a patient who did not feel safe being identified was identified. And the health system had to deal with that. There was another cautionary tale that I shared in that training around a physician or a clinician of some kind that said, "I like what I like," and posted the back of a woman in a patient care area. And it ended up in that several people being terminated at a health system and a lot of reputational harm to the organization. There was another where, somebody inadvertently posted PHI information that disclosed vulnerable information about patients. All of those things were posted to personal accounts, but they were posted while in the workplace, in areas that really breached confidentiality and the trust that the public has, and making sure that people can come here and feel safe to be treated. And so those are the kinds of behaviors that we're really trying to abate. I would also say, though, we don't necessarily want people to be posting malicious or hateful things with their JPS badge on, because whether we like it or not, our employees are a reflection of our organization. And so we are discouraging that. We're saying, if you want to post hateful things, please do that, but don't post us and don't tag us and don't wear your JPS badge, because ultimately we want to be recognized for providing exceptional patient care and not, distracted by whatever personal thing you have. We want you to have the space to do that, but we don't want you to do it in the workspace, and we want you to make sure you're safeguarding patients when you post it.
Policy that would be at the most different level. We just not the level that just one thing you want after.
Sure.
Progressive discipline.
Sure. So from my perspective, we look at these on a fact-based determination and we walk through what happened. I think having a HIPAA violation or a PHI violation is probably a similar standard without regard to where it happened, right? We have a matrix for that. If it's bad behavior, typically that's not going to be terminable. And I'm very sensitive. I would say Rihanna and our legal team is very sensitive to those national labor relations protections that exist for employees, to make sure that we're not having a cooling effect. We want people to be able to talk about, what's going on at work, but we would look at those in a fact-based determination and make a recommendation based on what the appropriate level. So this is not a blanket off with your head kind of thing.
Tell me about the TikTok ban. Is that
It's just on the job.
So that's a statewide ban. That doesn't have anything to do with us. And so we are just observing the requirement as a state employer in Texas, that you cannot utilize TikTok on government internet. Mm-hmm.
I'll do all on that then. TikToks. I think definitely, I kind of think there's a way to word it. We have this nice section on no restrictions on rights, but it deals with labor issues. I'd like a sentence or two that makes it clear this in no way restricts somebody's First Amendment rights. I think that would be good for our labor relations, that we're not telling people what they're saying, unless it impacts yes, it's a bad job. But we've got all the legal protection for labor law, but I'd like it to be broader than that and cover First Amendment. No one could say, "Oh, it tells me what I can post on, whatever." We don't. JPS or patients.
Yeah, I got it.
It's on page 30.
Yeah, I thought we had it in here.
Yeah, I was gonna say, that's what I was
That's what I was looking for.
yeah, I think that.
It's the very bottom.
No restrictions on legal rights.
Yeah, I think it's covered off.
See it.
Component procedure. Is it, what is it?
You're just saying it doesn't reference First Amendment specific.
You talking about the sentence that this guideline is not intended?
Mm-hmm.
But that doesn't mention the First Amendment. It mentions two laws. I'd like to be broader than that. We're making an affirmative statement that we're not limiting our employees' First Amendment rights.
I don't have an issue adding it. I mean, because we do talk about legal rights.
It says or other laws.
Yeah, I said I don't have an issue specifically referencing it. That's fine. We can add it.
Okay.
Yes. Any other questions, concerns? Right.
Is that it, Blake? That's only, is that your one recommendation
That's
to
my
be
other-
added?
yeah.
Okay, and legal doesn't have a problem with that. Did anyone else have a problem with it? Just,
And just to clarify, I mean, we will add it to our procedure. The board is actually just approving the overarching policy.
Yes.
Let me
okay,
ask a related question. It's not about social media, but these phones all have cameras.
They do.
And it'd be easy for employees, or patients, or visitors, innocently taking a picture and capturing some PHI in the background. Do we have any policies doing that?
I think it is in our policy, but I mean, the bottom line is I'm pretty sure that it is. But the bottom line is any breach of PHI, any breach of PHI is a breach of PHI. And so we would treat it very similar to if you took a folder with PHI in it and went and got McDonald's and left the folder there. I mean, it's,
So Blake, first of all, we do quite a bit of training
We
with your
do.
staff to make sure there is no patient information
out
out.
in work area, in non-work
You're
areas.
signing off for your, epic and not leaving discharge summary. I mean, that is part of our safety grounding that we do and training that we do with our staff so that it's not inadvertently got information or take pictures of it so it really should not be exposed in a way in which staff or patients should be able to have access to even inadvertently take something like
Well,
that.
it'd be inadvertent.
Yeah, yes. And I would say in addition to the policy, when you actually read section 6 of this policy, it really is very broad in it. So it doesn't just limit to social media usage or not. It basically gives our stance in general, reaffirms that stance. Team members may not use or disclose any protected health information or patient identifiable information of any kind in any medium without the express written permission of the patient, without regard to whether it's on social media or not.
Okay, good. Thank you.
Thank you. We do.
no.
We don't, you're right, we're not subject to collective bargaining. We reference that as for guideline. Yeah.
But also in previous years, the NLRB has gone after private organizations that were not unionized in spaces where they have actively worked to contravene not this level, but clamping down and not allowing employees to speak freely. So that provision really is determined, it is included to acknowledge that there are instances where having a cooling effect on employees' ability to talk about work conditions can be problematic, whether you're unionized or not. So from my perspective, I think it's wise to have it there because depending on, what the political tide is, we need to make sure that people understand that they still are free to talk about work conditions or other things that are appropriate.
Because we said don't get the other law. But we don't have any law. We need put it in there. It's too covered as part of the cloud that we don't have it as a vibration and then no any other thing. Wow. That's all.
Okay.
Yeah, we could have left it just general, so that it's not, that we don't get into this like, oh, we forgot to mention this one or this one. And it's not,
Those two, then the rest.
correct, it's not specifically applicable.
If we don't need it, it's not.
Okay, any other suggestions? Because I think all we are approving is the social media policy.
Correct.
So did anybody have any comments on that? Because that's what we are voting on. Yeah, they got it. They'll work on it in your procedure, but we are approving the policy.
with my First Amendment added.
Didn't have it.
The policy itself doesn't reference any of those. We always bring the procedures so that you all will know how we plan to implement. The board votes on the broader policy. The procedure is what we would add that to, Blake, but it's not
Okay,
in
the
the.
procedure's not the policy.
Correct.
What the policy's that two, just that two.
You-
Correct.
those-
'Cause
that's
y'all-
it.
You all set policy for us.
All these policies have it. Do we have any training in place to help them not share? That's more important than policy itself.
So we have education, our annual CBLs. This is a new policy, so we will have to incorporate education around this in particular to help people be able to operationalize this, but typically we do cover that off. And new team member orientation and new leader orientation, and then through our annual re-education.
So are we voting on this two-paragraph policy?
That's what we're
with no
voting on.
detail to back it up?
They gave you the information showing the backup to it, so you would have an idea, this is what it is. You've given input on that. They would take those and legally saying they can incorporate. But what the board actually approved is the policy.
But the policy really doesn't say anything.
Well, it just says we have one, and it's for media, and it's for all the employees, and they have to follow our policies and procedures.
Shouldn't the policy at least refer to the procedure? I know it's listed as an attachment, but that doesn't incorporate it.
That
Otherwise,
is,
the procedure could be changed without board approval.
We have typically brought those back when we're making substantive changes to those, but that has always been the understanding is that board sets the broad policy, and then we will implement a procedure that is within scope of the policy.
I think the policy statement should at least refer to the procedure, which it does not, other than it listed as an attachment. That's not the same as saying, as spelled out in the attached procedure.
Well, then that has you guys are really, if you incorporate it by reference, then y'all are approving both. And that's not
Are we approving the procedure or are we just approving the two paragraphs?
you're approving just the policy.
Okay, I think that policy should at least, and maybe this is how you do all your policies and procedures, but I
It
think
is.
it should at least refer to the procedure.
but
Otherwise, they're separate and they're not connected.
I don't see it that way. I see that you have a policy, and the note and attachment has the HR 8301 social media procedure goes with this policy. That's the notation that says you have a procedure with it. And they must follow the policy, and the policy is stating that the social media procedure.
So I think we all agree that it should refer to the procedure in some way. And you're saying the attachment's sufficient,
I think so.
kind of like say, as spelled out in the attached procedure or something. It could be more formal than that.
So Joint Commission has recommended that we do it this way. Because all we have to do is show that we have a policy in place and that we follow the policy. You can get yourself into some regulatory problems by having the procedure all caught up in your policy. It makes it much more difficult to actually meet the terms of the policy when procedure is somehow incorporated into it. So all, as to Dorothea said, is to show that you have a policy and to state what that policy is so that employees can say, there is a policy that I can go to that says that this is, regarding our social media policy. It gives them direction. Procedure now gives them more clarity.
If I read this policy as an employee, I know there's an attachment that go with it, and that's the HR 8301 social media procedure. So, I don't see that we have to have it in the policy, in the overall policy, because you have a note and attachment that says this is what you would go to if you
Colin,
want
how do
additional.
Can you give some thoughts on this? Because when we're asking you to audit, you audit against the policy.
And I think we've gotten this discussion, I think when you played before about, so when you're a regulator, the first thing you look at is the organization following its own policy and procedure, right? So if it's a 2-paragraph policy, we're following the policy. You start getting into a procedure, which can be 15, 16, 20 steps, and we miss one, then we're all of a sudden in noncompliance. So that's what we're trying to guard against. Correct.
The board sets policy. The board
Who approves the procedure?
Yeah, we have a policy committee and we have a policy approval process for that.
I'm sorry? Absolutely.
So, Colin, you wouldn't even have a sentence that says this, that it's spelled out in the latest procedure?
I would agree with the chair. All of our policies and procedures are in the same way, where if there's an underlying procedure, it's an attachment to the policy. And I think that is the reference. And when you
To add some protection.
So that's what you really get around the paper. Where you gonna see it? Here we go. It's going to be. Okay. All right, any more discussion on the policy statement? There being none, and a motion for approval of social media policy. It's been moved and set. All those in favor, approve the policy, signify by saying aye. Motion passes.
All right, thank you. That concludes my presentation. I appreciate you.
Session at 2:35 p.m. And we do not have any action items, but what I will state is I will send the CEO's evaluation summary to all board members along with our committee recommendation. Okay? There being no more, we are adjourned.